More Sydney venues have been added to a growing list of places that people have visited while infectious with coronavirus in the latest outbreak. The Bondi cluster currently stands at 11. The New South Wales Premier has warned restrictions are likely to be extended beyond tomorrow night. Reporter Laura Hyams has the details.
The numbers are going up and it's not good news for the community or the government. The Premier Gladys Berejiklian alluding to the fact that mask restrictions may be extended beyond the previous deadline of Wednesday at midnight. Currently, Sydney-siders are required to wear masks on public transport. This is for the Greater Sydney area and also the surrounding parts of that. The masks are also meant to be worn in various settings. So that includes in the retail sector, aged care facilities, theatres, and also front of house hospitality workers. With those two cases, that brings the cluster up to 11. The two cases include a woman aged in her 50s. She is located in the northern suburbs, and a man aged in his 30s. He is located in the eastern suburbs. The good news is that those two individuals were already close contacts of existing cases and they were already in isolation. The Transport Minister said many people were heeding the rules, but he did notice that some Sydney-siders were flouting the guidelines.
Just even in the city last night, I did observe quite a number of modes of public transport where people just didn't have them on, and we need people to wear them. It's in your own interests, your loved ones' interests, your community interests, and particularly on buses where we know that people are quite often in the breathing space of others. We need everybody to put the masks on. Otherwise, there is the fine in place.
As the Bondi cluster grows, so does the number of exposure sites. Health officials have added a number of businesses and also public transport routes to that list. Anyone who visited these sites at the particular times that have been advertised by health officials is urged to get tested. Adding to that list is the BP Baulkham Hills, the Salvo store in Tempe, Fresh Nails in Bondi Junction, and also the public transport route involving the bus 614X. This is a route which travels from Baulkham Hills to Sydney. This is on several days, Tuesday the 15th of June, morning and evening transport routes in that. And in addition, the 600 bus. Now, this is a route which travels from Northmead to Parramatta, and there have been several times included in that. Of course, the advice from health officials is anyone who has symptoms of COVID-19 to go and get tested.
Laura Hyams reporting there. Queensland health authorities are investigating how a woman in hotel quarantine contracted coronavirus from a return traveller on a different floor. Reporter Michael Rennie has more from Brisbane.
Health authorities are still trying to figure out how a woman in her 30s who was a flight attendant contracted COVID-19 while she was staying here at this quarantine hotel in Brisbane CBD, which is just behind me. She was released from hotel quarantine on Saturday morning and spent most of Saturday out in the community while infectious. How she contracted the virus inside this quarantine hotel remains a mystery because they've been able to link her to another guest in the hotel through genomic testing that she actually contracted the virus through this guest. But this guest was staying on a different floor in the hotel, completely different area in the hotel. So how she actually contracted the virus is a mystery. They're looking at theories such as that it's through objects that were perhaps moving throughout the hotel, maybe through hotel workers themselves. What we do know is that she had the alpha strain of the virus, or what was formerly known as the UK strain of the virus. They've been able to confirm that. We've also found out about a number of other venues and areas that she had visited throughout Brisbane while she was out on Saturday. So one of them was the Hamilton Harbour residence. She was there between 9:30 a.m. and 12 p.m. on Saturday. At the DFO store near Brisbane Airport, she visited the Cotton On store between 4:10 and 4:30 p.m. And then she was also at the Park Regis Hotel in Brisbane CBD between 4:50 and 5:15 p.m. She also was in the lobby and used a female toilet while she was there. You can see other exposure sites on the Queensland Government Health websites. We've heard from Queensland's Chief Health Officer, Jeanette Young. She says that it's a mystery how she contracted the virus here in the hotel, but one thing they do know is that it was definitely in this hotel where she contracted the virus.
We're just working out how that transmission occurred, but there is no doubt that she has acquired it in the hotel or at some point when she's come into contact with that person. That person was not on that Emirates flight. They were on a totally different flight into Australia. They also work as cabin crew.
In some good news, 81,000 Queenslanders were vaccinated over the last 7 days. So it shows that Queenslanders are starting to get behind the vaccine rollouts. And that's a pretty good figure when you consider that Queensland receives 55,000 doses of the Pfizer vaccine from the federal government every single week. So health authorities here are going to be asking for more doses of the Pfizer vaccine as the rollout continues.
Victoria has recorded no new local coronavirus cases as the state plans to ease restrictions again from Friday ahead of the school holidays. Reporter Zali Karismal joins us now from Melbourne. Good morning, Zali. Great news, no new local cases there.
That's right. Good morning, Roz. Another donut day in Victoria today. It's really looking like we're seeing the tail end of this outbreak here, which is great news. We just had 28 active local cases as of yesterday. That's likely to again drop today, but it does mean that we are on track for more restrictions to be eased on Thursday night. And there's also great news for Victorians hoping to leave the state for school holidays, which kick off on Friday, with news that more Victorians will be able to travel to more states and to New Zealand as well soon as well. So the Northern Territory reopened its borders overnight. That's looking quite appealing to me this morning. It's 5 degrees. The real feel is 2 degrees. But Tasmania has also reopened its borders to Greater Melbourne overnight, and New Zealand will resume that quarantine-free travel from midnight tonight as well. So really great news here for Victorians after a pretty difficult time.
Are the restrictions due to be eased then, Zali?
Yeah, they are. So the Victorian government yesterday confirmed that we are on track to ease restrictions. We're a little unsure yet on exactly what the new restrictions will be. I don't think it'll be a complete snapback. They've said that several times. But we're expecting things like, visitors to homes, that kind of thing.
The states and territories have been calling on the Commonwealth to increase supplies of the Pfizer vaccines. What is the situation with supplies of Pfizer?
Well, supply, it's safe to say, will remain an issue for some time still. The Victorian government, has been quite vocal on this issue in recent days. The acting Premier, James Merlino, describing the rollout as a mess, saying the state is facing a shortage of Pfizer doses in July and August. It's predicting it will have to halve the number of first doses that it administers in order to have enough supply for those second doses. So we had that emergency National Cabinet meeting yesterday. It doesn't appear that there's been any bump for Victoria's allocation. We do know that GPs will be getting an increasing number of Pfizer doses as well. But we did hear from the head of the vaccine task force, Lieutenant General John Fruin, yesterday, who acknowledged that really authorities are still very constrained by supply, that they're having to carefully manage the resources that they do have, but they are expecting that availability to ramp up from August and into September and then later into the year. And they're still hoping that every Australian who wants a vaccine will be offered one by December.
Thanks, Sally.